And really, we see this as almost like a quadruple win, if you want to say, where the health plans win, right, by having decreased costs using providers like pharmacies and pharmacists to do that and to help improve their STAR measures. Pharmacies win by increasing reimbursement for those services, but also that personal satisfaction and helping that patient. The patient wins ultimately because they're the receiver of these services, helping them keep healthy and maintain lifestyles that they're used to when they were younger. And then lastly, obviously, vendors like yourself win, connecting all of us together.
Welcome to the Pharmacy Quality Solutions Quality Corner Show. Buckle up and put your thinking cap on. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. Welcome to the PQS podcast, where we focus on medication use, quality improvement, and how we can utilize pharmacists to improve patient health outcomes. I'm your host, Nick Dorich. I'm excited today. Our guest is Nikki Price, and she is Director, Managed Care at Albertsons Companies. Nikki, how are you today? And welcome to the show.
Thanks, Nick. I'm doing great. Appreciate being on.
Fantastic. Well, Nikki, before we start, and we're going to talk about all the great things that you are doing, that your pharmacy team members are doing at Albertsons as you're providing patient care services in your local communities. But before we do that, let's make sure that we know who you are. So can you give us a rundown, what is your background in healthcare? And then what is it that you do? How would you describe your role in Albertsons today?
Sure, Nick. I've had a lengthy career. I've graduated from Purdue University. I am a pharmacist by trade and have had a number of opportunities from working in our stores to being in the HR area with recruiting pharmacists and interns, part of our education department, and now in also operations, overseeing pharmacies at a couple different levels. But now I'm in our managed care department. So I work directly with our PBMs in terms of contracting for reimbursement. So see that very closely, but also responsible for our medication adherence and our gap closures for our pharmacy teams, working with vendors like yourself and health plan payers.
Excellent. I think one of the things that I've always found really interesting for many of the chain pharmacies, when I ask about, hey, what's the background or what's the experience, it often is like a roadmap where you've hit almost every department that could be related to pharmacy. And I would note, usually, folks like yourself have spent time, working in the pharmacies. You were a frontline pharmacist. You even whether it's through pharmacy school or going through for you spent time as a pharmacy technician. So there's very much hands-on experience. And one of the things that I always remind folks is that, hey, we as pharmacists are great patient advocates. We're great at providing patient care, but it takes a broad team. And I think for folks like yourself in the organization, you get to see that experience now as well. And we're really excited to have this chat with you here and providing some input, providing some of the experience from the Albertsons team. Albertsons and the Albertsons company, the family of pharmacies and groups that have made up that group, have always been a leader when it comes to pharmacists and providing clinical services. I think back many years ago to being at APHA and them taking really pride in being the first pharmacy chain that was providing immunization. So excited to have you here today and be talking about how the organization is continuing that mission and pushing forward. So, Nikki, we're going to talk about that work. Are you ready to go for today's conversation?
Absolutely.
All right. Well, first off, let's talk about this. You already shared, that your team, you're working with the PBMs, you're working with the health plans on contracting, and also with vendors that are supporting the approach that your team has taken. So let's address, the first things first. Your team works with us at PQS by Innovaccer. What do you see? What do you see as the value? Why is that a partnership that your team engages with?
Yeah, so we partner with PQS for a number of different reasons. First, we feel that your mission aligns with our mission, which is connecting payers and providers together to expand pharmacy services and expand really pharmacy practice into areas of growth through expanding scope of practice for pharmacists, allowing them to practice at the top of their license, payment, fair reimbursement for the services, and really aligning with our mission to overall improve patient lives, to make sure that they stay healthy, stay out of the hospital, prevent tragic events, which in turn always reduces healthcare cost. And so through this partnership, our pharmacy teams really help improve medication adherence and provide that point of care testing for health plans. all of which at the end improves patient outcomes. And really, we see this as almost like a quadruple win, if you want to say, where the health plans win, right, by having decreased costs using providers like pharmacies and pharmacists to do that and help improve their star measures. Pharmacies win by increasing reimbursement for those services, but also help that personal satisfaction and helping that patient. The patient wins ultimately because they're the receiver of these services, helping them keep healthy and maintain lifestyles that they're used to when they were younger. And then lastly, obviously, vendors like yourself win, connecting all of us together. So one of the other reasons we really partner with you is because of that, is you're building relationships and connections across the healthcare industry. And then also, your team is very responsive to our needs and providing that critical data to help us make decisions and react accordingly. So by getting the data from Equip and the analytics dashboard in that, we can really start tailoring approaches and strategy towards different plans for different pharmacies, even down to the patient level.
Thanks for that input, Nikki. And if I was creating a word cloud on the reasons that are, why pharmacies should partner with Equip or partner with PQS, I think you covered everything that I think about internally here as part of the organization. But two parts I'll call out as particularly important. It's good for the patient, yes, and it's good for their health outcomes. But two, it's good for the pharmacies, not just in terms of the reimbursement, which is important, but also for the pharmacy staff and being able to engage and provide clinical services, something that we went to pharmacy school for, or in something, whether it's the pharmacist or the technicians, it's something that makes us feel good. And that's difficult to quantify, but it is important. It is important. It is a quality of life. It's a quality of work aspect, especially given, today's retail market, today's job market, and really keeping pharmacists happy and healthy, just like we are for the patients. So, Nikki, I'll transition us to our next question here. And, we're thinking about considerations. There's different performance programs. There are different opportunities that are facilitated right through Equip or by PQS that your team has to take a look at. Your team is running a business, and there's parts of it where some programs are not all programs are going to be created equally. What does your team consider when new opportunities or programs are being offered by health plans? Is this something where you're looking at financial design, patient impact, how it would be operating through workflow? What are the parts that, and I'm sure you could list along you could provide a long list of items, but maybe what are the top items that are most important to you for these sorts of new programs?
Yeah, really all of the above. Like you said, it's a laundry list, right? But really, when we're presented with new opportunities or programs, we think about how it's going to impact the patient, how it's going to improve their life, but really, how is it going to impact our store teams? And how can we make it easier for them? And of course, then the financial impact as far as, looking at the ROI that's associated with it. And so we provide different tools to our pharmacy teams through Equip, but also through the financial incentives to help them understand the why. Our pharmacy teams truly get the why when it comes to the patient piece of it. But putting it within workflow, if we can streamline it as much as possible for them to make it easy, we know that the success rate is going to be that much higher. We've also provided some additional tools for our pharmacy teams through centralized services to help free them up to provide these services as well too. And so doing that, looking at the patient impact and looking at the financial impact really are the three major pieces. And then that last piece of the puzzle is we think through, can we continue to connect with that payer and expand services that much more? If we can prove our success with the initial program, does that mean that we can expand even further with them?
I think of this, Nikki, it's somewhat like a spider web where, when you're considering a program, if we're pulling on one string, it's going to have an impact it's going to have a ripple effect across everything, right? So I think this is one aspect where when we work with health plans, it becomes very important to consider everything that's impacting a pharmacy. And we're certainly trying to push the message that, hey, these programs can't just be a launch right here, right now, and today. There needs to be a lead time, right? There needs to be a runway for the airplane to take off because you're operating many systems and you need to be able to ensure that you're getting that lift to get the result, which here we're not trying to get an airplane take off or land, but we are trying to provide and expand patient care services. And your pharmacy teams want to do this. your team at the offices wants to do this as well, but there's an important consideration for making sure it's planned out in advance so everything can be taken into consideration. Okay, next question here as we're looking at this, and you talked about this a little bit, where there's very much an impact for workflow and the pharmacy team members that are engaged with these services. So when it comes to new services that your pharmacies are providing, and I'm saying pharmacies as the business, as the physical
Right.
location, but there are different team members that are involved with these programs or with these solutions or with the patient outreach, right? Any of us who have worked in a pharmacy knows it's not just the pharmacist talking with the patient. So
Right.
can you share a little bit of information about, what pharmacy team members are involved with your quality improvement process?
Yeah, it certainly takes a village when it comes to this. And so when we look at our corporate offices, our corporate backstage teams, it's managed care team members like myself who understand the contracting, who understand where the opportunities lie. It's our clinical services team that really help provide some of the guidance down to our pharmacy teams. Our systems teams that really helps from the IT approach to help streamline that. And of course, our operations teams that are, setting the expectations, following up, educating at store level. The most important team members, though, are really our pharmacists and our technicians. Um, Both of them have credible relationships with our patients. And through these programs, it actually helps, in my opinion, strengthen those relationships as well, too. Because once, someone takes care of you from a healthcare perspective and helps you understand, like, hey, like if you don't take your blood pressure medication every day, this was what could happen, or they identify, a number of different issues that could happen, whether it's a drug interaction or drug disease state interaction, whatever it might be. But us continue to, be that frontline healthcare that's so available to them. That pharmacist and that technician is really the ultimate piece and the ultimate, the most important piece of that puzzle. They really know them best. And in fact, they see them more often than their primary care providers see their patients. And so this is where I feel pharmacists have a real value to health plan, but really where we feel our pharmacists are the most important piece.
Yeah, that's fantastic. I always think about it, and it's often said a reference that, healthcare is local. And when we think about it specifically from the pharmacy aspect, it's that local pharmacist, it's that local pharmacy technician where, whether it's us at PQS, yourself and the corporate team at Albertsons or health plan programs, these are all things that are going to be well intentioned. But the person that's truly getting the patient to make that behavior change, it is that pharmacist, right? So giving them the tools, the information, and empowering them, providing them the workspace to have those conversations and be the change agent for patient, that is the crux that makes all of this work,
Right.
that truly makes the wheel turn. All right, Nikki, let's talk a little bit actually now about the patient aspect of it. And the Albertsons company I've referenced already that Albertsons has been a leader in providing, offering patient care services and really letting pharmacists practice at the top of their license. But some of these programs are new, or maybe they're new to patients in certain geographies, right? They haven't expected a pharmacist or a pharmacy team member to provide them that service. But your team has been increasingly providing services like blood pressure readings, hemoglobin A1C screenings. Obviously, we know all about immunizations and test and treat, and new immunizations like COVID boosters or RSV. What's the patient experience like? What is the patient response? I have to imagine that there's some aspect of, oh, hey, I didn't know I could get this at my pharmacy. But
Mhm.
does this further drive, loyalty? Does it further drive trust? And are people now expecting more from your pharmacies as they receive these additional services?
Yeah, it's a really great question. And we look at that and measure that on a regular basis through residency programs and so on. But overall, patients have responded positively to services, offered by their trusted pharmacist, their trusted technician. Obviously, COVID helped improve that perception even more because many patients realized they could get their flu shot from us, but then they realize, oh, I can get my COVID test here. I can also get this. And pretty soon, those services just, what else can I get from the pharmacy? And so by providing that convenience, obviously we're right there. Patrons are shopping in their grocery store on a weekly basis. They can stop by and ask a quick question if they need to. But we also, and then also with expanded hours versus their primary care provider, weekends, nights, and so on. But also providing that care and that empathy has really been key for patients to understand that, hey, no, you really do care about me. You're not just going to fill my prescription for this and do that, but you also are here to help manage my total health. and especially for patients who have challenging disease states, have really, gravitated towards that.
All right, Nikki, before we wrap up, I've got two kind of questions, and these are going to be a little bit different in nature here as we wrap up today's conversation. The first one is going to be kind of what's the ask, what's the recommendation to other pharmacies? And then I want to finish with what's a recommendation or an ask that you would have to health plans when it comes to engaging with pharmacies. So let's start off with that question. And your team, the Albertsons company, has been one that has embraced providing primary care services that have changed how you've operated, workflow to allow your pharmacist to step out from just doing that medication dispensing process. Don't worry, folks, the pharmacists are still involved with that. Don't worry about it. But providing them the capability to provide those patient care services and to communicate with patients around those expectations. Not all pharmacies are there yet. So, do you have a message, to other pharmacies about, what it means to embrace primary care services and value-based care opportunities?
Yeah, I would say dive in. The water is warm. So, and really now is the opportune time to partner with payers and patients, as pharmacies demonstrated that we can provide these services easily. You have to make it easy. Logistics are very key. You have to streamline it, but really, as we really need to get to steady state. As more pharmacies get involved, the better it is for the pharmacy industry, and to show what really pharmacists can do within the total healthcare team and for the healthcare plan. And so by doing this, it improves our perception, so that health plans will come to us more often and more frequently, giving us more opportunity to do that. And by doing that, we know that then we can continue increasing reimbursement, increasing payment for services, and really making pharmacy a sustainable career path as well as an industry.
All right, Nikki, and fantastic response. And that's the message to pharmacies. Let's flip it around now.
Yeah.
What's your message to health plans about engaging and why they should engage? Either, if those that are already on board with it, why should they continue to expand those opportunities or capabilities? Or for those who are not yet jumping in, what's your message to them about why they should partner with pharmacies?
Yeah. So really, again, kind of going back, like your pharmacist sees your patient, more often than their primary care provider does. And again, we're frontline, we're convenient, we're easy to use, but really we are a healthcare professional that has, 6 years of experience or more, depending if you've done a residency, a fellowship, and so on, that really can practice to the top of their license and provide these provide these services so that health plans can improve their star measures. And with the ongoing evolution of star measures right now, they're going to need pharmacy that much more. And for social determinants of health screenings, for blood pressure screens, A1C, but managing the patient from a total disease state as well, like diabetes, for example. Many pharmacies do that, but they're not utilized by a health plan to do that from end to end. And especially when you look at pharmacies within grocery stores that have that nutritional component on top of that, you really get the all-in-one package, partnering with their provider as well too, of course. But really, health plans can look at us from a lower cost provider, an easy provider use, more convenient, but also one that can provide the utmost greatest service to their patients.
It's really a fantastic message, and Nikki, we're in this industry. It's always a surprise that more people aren't, more groups aren't on board with it already. But it's really the part here, especially, and I'll add for health plans, another consideration, right? It's more important, or increasingly becoming more important, when it comes to the member, the patient's satisfaction, right? And that's a part where a pharmacist, a pharmacy, can really help to make sure a patient understands their medical benefits, prescription benefits, providing these services at a site that's even more accessible and then their primary care or the other office visit. So there's a lot of opportunity here. And as I look at the future of pharmacy, I get this question a lot. Hey, what does the future of pharmacy look like? I'm hopeful. There are all of these opportunities for pharmacists, for pharmacy and pharmacy technicians, to provide these patient care services and to truly elevate the practice in a way that's meaningful and, as you said, Nikki, sustainable for our profession, but also in a way that is meaningful, accessible, and affordable for the patients that we're serving. So we're in a great position moving forward. I'm really excited. I'm really glad that we got to have you here. We really enjoy working with the Albertsons team. and your team really showing that, hey, yes, this is the value of pharmacy, that pharmacists can provide these services. And we don't get to see necessarily the pharmacist to patient aspect, but we do see the results on the improved health outcomes, which is what we're here for. So Nikki, as we close for today's podcast and for today's recording, I've got two questions. The first being, if folks want to get more information, from you or about the programs that Albertsons are doing, or if there's student pharmacists or even maybe some more experienced pharmacists that you mentioned residency programs, are there things there? What's a good way to get in touch with you? How can people reach out to you? And then the second part is, do you have a message? Do you have some words of wisdom, or maybe some words of excitement that you would like to share, with pharmacists, but in particular the Albertsons pharmacists that may be listening?
Sure. So first of all, feel free to get a hold of me. LinkedIn's a great way to reach out to me. You can find me there under Nikki Price. You're more than welcome to email me, nikki.price@albertsons.com. That is not a problem whatsoever. Happy to connect with anyone through either of those channels. And then lastly, really want to just thank our pharmacy teams. They do so much every day that they don't get credit for. And so whether it is helping a patient, save their life from, acute event that's happening right then and there, or whether it's something long-term and through medication adherence programs, but they're recognizing the industry as doing a fantastic job, and really want to appreciate them as far as what they do every day for their patients and for our company.
Fantastic message and a great way to end. So Nikki, again, on behalf of myself and the team here at PQS, we thank you for all the work that your team does. We thank you for joining today to help share this message of positivity and a great path forward for pharmacy as well. But for our audience, that does mean now that we have wrapped up this episode of the Quality Corner Show. So we do thank you for joining us today. We hope you listen to our next episode. And before we go, we have one final message from the PQS team.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.